In today's video, we have a question answer session on depression. Again, thank you to those who have sent me the questions. I have organized it in an order that will make sense for the video. So let's get going because we know that depression affects millions of people across the world. It is a very difficult condition to live with. Often people don't understand what they might be going through and they might say, well, it's like a dark cloud. People have said to me, my brain feels foggy. I have everything, literally everything. I've got a good job, I've got a good family, yet I'm not enjoying anything. I feel quite dark. I feel empty inside. People will say I'm like in a dark hole. Different people describe depression differently. Some have even said to me, well, it almost feels like I'm looking at myself from above, and that's how life seems to me. I cannot connect with my family. That's another common way that people describe it to me. And again, there may be so many other ways of describing depression. It affects every aspect of an individual's life, work, family life, enjoyment, overall quality of life, and causes a lot of distress when it is severe as well. Not just for the individual who is going through the condition, but also people around them, spouses, parents, children. They all notice that their loved one is not connecting how they did. They're not enjoying how they did and feel worried about them. So really important that we talk about this condition because there is a lot we can do about it, and that is what I'm going to discuss with you later in the video. Now, a lot of people say to me, well, I have been told I need to pull myself together, or I feel I should be able to cope with this. I have grown up seeing my parents really work hard and cope with life. Why am I not able to do this? Really, really important that we leave some of this internalized stigma about mental health behind us, or at least try and work through some of that. If we had a condition like diabetes or another physical health condition, we would never be questioning whether we need any help with it or why is it happening to me. It happens, these things can happen, but what is important to know is that there is no need to feel stigmatized about it. There's no need to feel incompetent if you are seeking help for these conditions, because there's so much help around, and you might be pleasantly surprised as to how much people understand about these conditions. So let's start off with the first question. What causes depression? Like all other mental health conditions, the cause can be multifactorial as opposed to just one thing causes it. Sometimes there can be just one life event causing it, but often it is multifactorial. We cannot ignore that there could be a genetic vulnerability, and then often people say this as well, that I have got a lot of depression in my family. What they're trying to say is that there is some kind of a genetic predisposition or a vulnerability that people can be predisposed to having the condition when the right triggers are in place. Now, there are biological factors. For example, it is known that certain chemicals in the brain like serotonin, noradrenaline, dopamine, they are responsible to some extent to manage our mood, sleep, appetite, and therefore, when they are imbalanced, individuals can experience depression. Let's talk about psychological factors that can cause depression. Now, we all know that it is quite important to understand how our brain gets programmed during our growing up years. So there's the nature, which we're talking about, the genetic and the biological elements, but then there's the nurture element where the environmental factors kick in and affect how our brain is programmed, if you like. So let me give you an example. Now, if a child during their growing up years has suffered significant bullying or has felt throughout their growing up years that they're not getting it right, I'm useless, I'm not good enough, you can imagine that they will form a core belief or a value that I'm not good enough. So automatically their emotions, their behaviors would be dictated by this core belief that I'm not good enough. So you can see how going through their lives, they will be quite self-critical of themselves. They will continue believing I'm not good enough, especially when the stress is high at work or at home. If somebody even has a comment for them, they will say, I know I'm not good enough. So you can see how tipping into depression, how this psychological factor can come into play. So this is just one example. There are so many other ways in which difficulties, traumas, and what we experience during our formative years can affect our core beliefs, value systems, and affect the way we interact with life in the future. It's how we perceive ourselves, and how we perceive the world around us is very much formed in those formative years. And then there are, of course, societal and cultural factors. So what are the expectations of society from us? What are family expectations? What are our cultural expectations? Do we have to conform to a certain value system? The word should can come into it quite nicely, to be able to understand that often people think I should be able to do this, or I should follow this profession, rather than think, well, if you ask a fish to climb a tree, they're probably not going to be successful, even if there's a lot of pressure on them to climb a tree. So in so many ways, the societal pressures and expectations from families can come into play in determining how individuals view their role in society and what they should be achieving, as opposed to what their strengths are and what they could be achieving. Going forward, what could happen is that they may not perform to their should be expectations, and therefore their mood can be affected because of that, because they can see themselves as failure in this whole thing. And then, of course, we all go through difficult life events. There is grief, there is loss. We lose family members, we lose loved ones, we have breakups, we have conflict, difficult neighbors, difficulties at work, all kinds of life events. And often these life events can come together as well. We say that it happens in threes or fives, and I often see individuals where everything seems to be crashing down around them in their lives. And of course, we all know from experience that their life will get better again. Things will get back on track. But when going through that very difficult time, of course, they feel more predisposed to depression, and can feel the depressed mood for a period of time. And that is quite common. Again, there are natural disasters. We've just come out of the COVID pandemic. We know that these situations can lead to a lot of depression. So there are multiple factors, and sometimes they come together, which means that individuals are more prone to depression. So what are the key symptoms, and how does depression present? As I already said, different individuals are different, and we all experience symptoms for any organ in the body differently, or to some extent differently. But as professionals, we look for depressed mood, or we say low mood, and lack of interest and enjoyment, along with many other symptoms like disrupted sleep and appetite, inability to connect and engage or enjoy things, agitation, restlessness, guilt, hopelessness, lack of self-esteem, concentration, all these things coming together along with depressed mood and lack of interest and enjoyment for a period of time that happens for most of the day. So we all know that, like the weather, our mood is variable, right? Nobody has a straight line mood, so everybody has a variable mood. So we have good days, we have bad days. But we, as professionals, diagnose depression when an individual experiences these symptoms for most of the day for at least 2 weeks or more, which means that the diagnosis of depression becomes more prominent, and we need to do something about it and treat it. So the question then arises, What can we do about depression? Well, you'll be pleased to know that there are a number of things that we can do about depression. In the first instance, if you feel that you are suffering any of these symptoms, you should speak to your loved one, family, friends, whoever you trust, your doctor. Sometimes we feel uncomfortable talking to family and friends about these things. Well, that is absolutely fine. Speak to professionals. There are lots of helplines available as well. So you may not even need to go to your doctor. You can just seek help just to first scope, what am I suffering with? Think about what is going on in your lives. Are there any stressful situations going on at work, in your family? Are you going through grief, loss, separation? What could be causing the symptoms? Once you identify the triggers, it's much easier to do something about it. Also, think about what is it about your life that stops you from moving forward in how you feel or makes you feel quite overwhelmed. For example, have you got a good structure, routine, a little bit of exercise on a daily basis? Are you doing things that you enjoy, or are you just constantly working? Have you lost your work-life balance? Has life become a rut for you? Because it can become for many of us. Is that one of the reasons that is contributing? So look at what stressors there might be and what simple changes you can make in your life to bring some comfort back in there. Again, very important, be compassionate to yourself. Don't criticize if you cannot do a piece of work. I could not finish this at work. I'm useless. No. Just be compassionate to yourself. Think, well, I could not finish this piece of work because I did what I could, and I will finish it at another time. And people will just have to understand. Of course, you can only do your best. By being self-critical, you're not going to do any better. Remember that. Think about other things like alcohol, caffeine, recreational substances. Are you using some of these coping strategies which actually will spiral you into deeper depression as opposed to helping you? Yes, of course, in the short term, you might feel better through engaging in these activities and you might feel a bit connected as well. But in the longer term, none of these are going to be helpful. So think about that. Also start looking at, are you feeling constrained by the I should be doing this, or I cannot seek help because I should be able to cope, I should be able to pull myself together. Start addressing your internalized stigma. Seek help from your doctors, and your doctors might recommend your local psychological therapy services called the Improving Access to Psychological Treatments. One of the treatments is cognitive behavior therapy that works with your core beliefs or the negative thoughts and how they affect your emotions, your behaviors, and try and work with you to identify your negative thoughts and how those can be changed to help your thinking patterns. But CBT or cognitive behavior therapy is not the only treatment that's available. Of course, if there are other factors, for example, if you're going through grief and loss, maybe grief-focused therapy would be better. If you're dealing with trauma-focused therapy might be better. If relationship difficulties are what is driving the depression, then you might need to think about therapy that is focused in that direction. So again, the reason why you are depressed would decide what kind of talking therapies might be useful to you. Now, if you feel that therapy is too far and this is something you can deal with because the symptoms are quite mild, often just understanding the condition, just understanding why it is happening, what are the symptoms, why am I feeling like this, and making some lifestyle modifications like I have just discussed is enough. Just keep doing things that you enjoy bit by bit, even if you don't feel like doing it. Just keep educating yourself on the condition and see if that helps. And of course, the next step would be therapy, as I discussed. Now, sometimes therapy isn't enough or it doesn't work for individuals, in which case your doctor may recommend medication. Medications are effective and they are recommended as well if individuals have moderate or moderate to severe depression. Again, there is a stigma associated with medication, but it works. And sometimes you have to think about quality of life. if you are in a place where the depression is affecting you, your family, and your entire life, you want to consider medication because you want to get better. Have a discussion with your doctor about how medication works and try and understand that this might be good for you. And of course, this is also about stepping into your recovery journey. This is one of the next steps you might need to take. And again, sometimes your doctor might recommend that you have therapy and medication together. What you need to know is majority of individuals, they recover from depression. So there is a lot of hope. You just need to take the first step. So what is the exercise for today? If you're experiencing any of the symptoms I have discussed, start your mood diary today. In the first column, write your mood. Write also how many hours a day are you feeling low in mood. In the next column, write what are the triggers. Do you identify any common triggers or stressors that affect your mood? Okay. Then in the third column, try and see how your behavior changes when you have these stressors, when your mood is changing, and how you are behaving in those situations. Try jotting this down for a couple of weeks. And if you find that your mood is not changing at all in 2 weeks, you do need to seek help. But in the meantime, while you're jotting this diary, start thinking about the triggers, start thinking about your core beliefs, identify what is the key thought that comes in all of these times that you feel low. What is the key thought? Do you feel I'm useless? Do you feel I'm worthless? And start putting a positive affirmation to that. Try negating that thought. Continue doing this over a period of 2 weeks and see if that makes a difference. If not, as I said, please seek help. So, watch my next video here, and if you have enjoyed and learned something useful, please like it, share it, tell it to all the people you know. Thank you for watching.